Hello friends, today we have a topic not often discussed over polite conversation, poop. But guess what? This silent messenger can actually reveal a lot about your inner workings. So buckle up because we're diving into 15 things your stool is trying to tell you about your health. First sign is color check. While brown may be the bullseye, stool color variations shouldn't send you spiraling into panic. Instead, view them as subtle prompts to investigate further. Here's a breakdown of the key shades and their potential meanings. Green or yellow, this often signifies fats not being absorbed properly. Think greasy foods, celiac disease, or even bile duct issues. Black, this can be scary, but don't hit the panic button just yet. Iron supplements, black licorice, or even certain medications can darken your stool. However, if the color is black and tarry or accompanied by bloody vomit, seek medical attention immediately, as it could indicate bleeding in your upper digestive tract. White or clay-colored, this pale hue can signal a lack of bile pigments in your stool, potentially hinting at liver problems or blocked bile ducts. Consulting a doctor is crucial to rule out any underlying conditions. Red, now this can get confusing. Bright red streaks usually point to hemorrhoids or anal fissures, while darker, maroon-colored stool might indicate bleeding higher up in your digestive system. Remember, beetroots can also be the culprit. Regardless of the shade, any persistent blood in your stool warrants a doctor's visit. Remember, this is just a general overview and individual experiences can vary. If you're concerned about your stool color, the best course of action is to consult a healthcare professional. Second is stool shape. Forget aesthetics, stool shape is all about function. Imagine your intestines as a sculpting factory molding waste into various forms. Let's explore what these shapes might reveal. The smooth stool, this is the gold standard, resembling a smooth, well-defined log. It indicates efficient movement of stool through your intestines, suggesting proper hydration and fiber intake. Think of it as your gut giving you a high five. The lumpy stool, bumpy or pebbly stools, often resembling rabbit pellets, can signal dehydration. When your body lacks sufficient fluids, stool dries out and hardens, making it difficult to pass. Upping your water intake and incorporating fiber-rich foods can help smooth things out. The fragmented stools resembling small, disconnected pieces can also point towards dehydration or constipation. However, they could also indicate conditions like irritable bowel syndrome, IBS, or Crohn's disease. If these fragmented stools are accompanied by other symptoms like bloating or abdominal pain, consulting a doctor is recommended. The mushy stool, mushy or even loose stools could indicate various things, ranging from temporary dietary indiscretion to more serious issues like malabsorption syndromes or infection. The key is to consider the duration and severity. Short-lived mushiness after a spicy meal is likely nothing to worry about, but persistent looseness warrants a doctor's visit. Third is size matters. Understanding stool dimensions can provide valuable insights into digestive health without delving into uncomfortable territory. While size matters to some extent, the key lies in interpreting extremes rather than aiming for a specific measurement. Tiny stool nuggets resembling marbles or rabbit droppings may signal constipation, possibly due to dehydration, dietary factors, or medications. On the flip side, excessively large stools could indicate malabsorption syndromes or underlying conditions like celiac disease or inflammatory bowel disease. Rather than fixating on precise measurements, it's more important to pay attention to how stool size affects your elimination process. Smooth, sausage-like stools that pass easily are generally favorable, but any significant or persistent changes warrant a discussion with your doctor to ensure optimal digestive health. Fourth is the speeding stool, when diarrhea makes a dash. Diarrhea, the unwelcome guest that seems to appear at the most inopportune moments, can range from a temporary inconvenience to a sign of something more serious. While the occasional bout after spicy food or a questionable indulgence might not be a cause for alarm, understanding the potential culprits behind your speeding stool can help you navigate this sometimes messy situation. The usual suspects: food intolerance, lactose intolerance, gluten sensitivity, or reactions to certain fruits or vegetables can trigger diarrhea. Identifying and avoiding these triggers can be key to keeping your gut calm. Infections, from bacterial and viral infections like rotavirus to parasitic infestations, various pathogens can wreak havoc on your digestive system, leading to diarrhea. Depending on the severity and duration, seeking medical attention and proper treatment might be necessary. Medications, certain antibiotics, laxatives, and even over-the-counter pain relievers can cause diarrhea as a side effect. Consulting your doctor or pharmacist about alternative medications or managing side effects can help. Inflammatory bowel disease, IBD conditions like Crohn's disease and ulcerative colitis can cause chronic diarrhea, often accompanied by other symptoms like abdominal pain and blood in stool. If you suspect IBD, consulting a gastroenterologist for diagnosis and management is crucial. 5th is the constipation, when elimination turns into a struggle. Constipation, the silent struggle that plagues millions globally. Straining, infrequent bowel movements, and a general feeling of stuckness, it can significantly impact your quality of life and overall well-being. But fear not, for even the most stubborn stool can be coaxed into cooperation with the right approach. Understanding the blockade. Constipation can arise from various factors including dietary imbalances, lack of fiber intake, inadequate hydration, and excessive processed foods can all contribute to constipation. Aim for 25 to 35 grams of fiber daily from fruits, vegetables, and whole grains, and prioritize water over sugary drinks. Muscle weakness, weakened pelvic floor muscles, often due to childbirth or certain medical conditions, can hinder stool passage. Kegel exercises can help strengthen these muscles and improve elimination. Slow intestinal transit. In some cases, the digestive system itself moves stool slowly, leading to constipation. Underlying medical conditions like hypothyroidism or certain medications can be contributing factors. Consulting a doctor to identify and address the root cause is crucial. 6th is the mucus stool. The presence of mucus in stool, often viewed with concern, actually plays a vital role in maintaining digestive health. Acting as a protective barrier along the intestinal lining, mucus helps trap harmful bacteria, facilitates smooth bowel movements, and keeps the digestive tract lubricated. While a small amount of mucus is normal, excessive amounts could be a sign of underlying issues such as inflammation or irritation in the digestive system. Additionally, the color and consistency of mucus can offer insights into potential health concerns, with greenish mucus indicating possible infection and blood-streaked mucus requiring immediate medical attention. When accompanied by symptoms like abdominal pain, bloating, diarrhea, or constipation, excessive mucus warrants further evaluation by a healthcare professional to identify and address any underlying conditions. 7th is the greasy stool. Greasy stools, resembling melted ice cream, can provoke concern, yet understanding their potential origins is essential before leaping to conclusions. Diarrhea, the medical term for fat presence in stool, primarily contributes to this oily sheen. Disruptions in fat digestion, attributed to factors such as pancreatic insufficiency, celiac disease, biliary issues, or rare conditions like Crohn's disease, could prompt such manifestations. Beyond appearance, factors like stool color, odor, and accompanying symptoms provide valuable diagnostic insights. Consulting a doctor upon noticing greasy stools, especially alongside other symptoms like abdominal pain or weight loss, is vital. Through comprehensive evaluation, including stool and blood tests, doctors can pinpoint underlying causes and devise tailored treatment plans, ranging from dietary adjustments to medical interventions. Remember, while occasional greasiness might be benign, persistent symptoms warrant medical attention to ensure digestive health. 8th is blood in the stool, when red raises concerns. Discovering blood in your stool, medically termed hematochezia, can provoke immediate anxiety, yet not all instances indicate a severe condition. Understanding the nuances of the symptom is vital for appropriate action. The color and location of the blood provide essential clues. Bright red streaks may denote lower GI bleeding from sources like hemorrhoids or anal fissures, while darker blood mixed with stool could signal issues higher up in the digestive tract, such as ulcers or inflammation. Black, tarry stool, known as melena, suggests digested blood from the upper GI tract. Considerations beyond color, such as the amount of blood, presence of pain, and accompanying symptoms, aid in assessment. Regardless of these factors, any blood in stool necessitates medical attention. Your doctor can conduct comprehensive evaluations to determine the cause and recommend suitable treatment, emphasizing the importance of early diagnosis and intervention. While some causes may be benign, others may require prompt medical intervention. 9th is the spicy surprise, when your gut reacts to the heat. Spicy food, with its tantalizing allure, can sometimes lead to unexpected surprises in one's stool. The compounds like capsaicin found in spicy foods stimulate pain receptors in both the mouth and digestive tract, triggering responses such as increased mucus production, changes in stool consistency, and occasional alterations in stool color. However, individual sensitivities vary, with some having naturally more sensitive digestive systems. To enjoy spicy food without discomfort, it's advised to gradually increase spice levels, pay attention to your body's tolerance, stay hydrated, pair spicy dishes with cooling foods like dairy, and consider supplements like probiotics. While most reactions are temporary, persistent discomfort or severe symptoms necessitate medical attention to rule out underlying conditions. By understanding your body's reactions and making informed choices, you can savor the fiery flavors without igniting gastrointestinal distress. 10th is the medication mix-up. Medications can sometimes throw your digestive system for a loop, causing unexpected changes in your stool. From antibiotics to pain relievers, various drugs can alter stool consistency, color, and frequency. Antibiotics might disrupt your gut microbiome, leading to looser stools, while iron supplements can result in constipation and darker stool color. Overuse of laxatives can lead to dependence, and NSAIDs like ibuprofen may irritate your stomach and intestines, causing constipation or bloody stools. Even antidepressants and birth control pills can have stool-related side effects. It's crucial to stay informed about potential medication culprits and how to navigate their effects. Remember to consult your doctor if you notice significant or persistent changes in your stool after starting a new medication, as they can provide guidance on managing side effects and adjusting treatment if necessary. 11th is the travel tummy. Traveling is an exhilarating adventure filled with new experiences, but it can also bring about the dreaded travel tummy. This discomfort often arises from changes in our microbiome due to exposure to different water, food, and air, as well as the risk of foodborne illnesses from unhygienic practices. Motion sickness and the stress of travel further exacerbate digestive woes. However, there are ways to tame the travel tummy. Packing probiotics, opting for safe hydration and food choices, managing stress, and having over-the-counter remedies on hand can help alleviate symptoms. It's essential to seek medical attention if symptoms persist or worsen. With preparation and awareness, travelers can safeguard their digestive health and ensure their adventures are filled with joyous memories rather than discomfort. 12th is the stress signal. Stress isn't just a mental burden, it can also take a toll on your gut health. The intricate gut-brain connection means that when stress levels rise, it can disrupt gut motility, digestion, and even the composition of your gut microbiome. This can result in symptoms like constipation, diarrhea, or changes in mucus production. Beyond stool changes, stress can also manifest in abdominal pain, changes in appetite, fatigue, and difficulty concentrating. However, there are ways to tame the stress monster and support your gut health, including identifying stressors, practicing relaxation techniques, exercising regularly, maintaining a healthy diet, nurturing social connections, and seeking professional help when needed. Understanding this connection and implementing stress management strategies can empower you to navigate life's challenges with resilience and a healthier gut. 13th is the age equation. As we journey through life, our bodies undergo numerous changes, including those in our digestive system. While youthful brown sausage-shaped stools may be the norm, aging brings about shifts that can alter the standard. With time, gut muscles weaken, slowing down digestion and potentially causing constipation. Changes in gut bacteria due to various factors like medication or diet alterations can affect stool consistency and lead to digestive discomfort. Additionally, age-related health conditions such as diabetes or thyroid disorders can further impact stool characteristics. Monitoring for significant deviations from your usual stool pattern, such as changes in consistency, frequency, or the presence of blood, is crucial. Implementing strategies like staying hydrated, consuming fiber-rich foods, exercising regularly, managing stress, and incorporating probiotics can support digestive health as you age. Regular checkups with healthcare professionals ensure timely intervention if needed. 14th is the listen to your body rule. In this comprehensive discussion, we've explored the multifaceted aspects influencing stool appearance and function. However, the most powerful instrument at your disposal is your own body. Deciphering the enigmas of your stool hinges on heeding your body's subtle cues and reacting accordingly. It's essential to tune into any deviations in characteristics such as consistency, frequency, color, and the presence of unusual elements like blood or mucus. Beyond the visual cues, accompanying symptoms like abdominal discomfort or unexplained weight loss should not be overlooked. When it comes to responding, minor changes may warrant monitoring, while significant or persistent alterations necessitate consultation with a healthcare provider. Severe symptoms demand immediate medical attention. Remember, your body communicates through its stool. By attuning yourself, interpreting its messages, and taking appropriate action, you can nurture optimal gut health and confront digestive issues effectively. Trust your instincts, seek professional advice as needed, and prioritize your well-being. However, it's crucial to note that this information serves for educational purposes only and does not substitute medical advice. 15. Don't be shy, seek help. When it comes to your health, discussing stool-related issues with your doctor is crucial despite the potential embarrassment. Seeking help early can lead to accurate diagnosis and effective treatment, ultimately improving your well-being and preventing complications. Remember, your doctor is there to help, not judge, so don't hesitate to share your concerns openly. Tips for making the conversation easier include being prepared, specific, and honest, and asking questions. By advocating for your own health and seeking professional guidance, you empower yourself to make informed decisions and lead a healthier life. So, don't be shy, speak up, and give your gut the attention it deserves. Remember, your stool is just one piece of the health puzzle. But by paying attention to it, you can gain valuable insights and take steps towards a healthier you.